Hi students, I welcome you all to Obstetrics and Gynecology with Mackler. So in this module, we are going to start with the next important barrier contraceptive, that is the today's sponge. So in the previous module, we had detailed discussion about the male-female condom as well as the diaphragm. Now we'll be starting with the today's sponge. So today's sponge is essentially a barrier contraceptive, which means it is going to act as a physical barrier between the male gamete and the female gamete. It is going to act as a physical barrier and prevent the act of fertilization, and it is going to prevent the direct insemination of the male gamete inside the female's internal genitalia. So when the male gamete and the female gamete is not going to meet, then therefore definitely fertilization cannot happen, and therefore there is no conception in that particular intending couples. So basically all these contraceptives which we have discussed until now in the last 2-3 modules are physical barrier which is going to prevent the act of fertilization, right? Okay, that is to be even more in simpler terms, that it is going to prevent the access of the male gamete sperm inside the cervical canal, or it is going to prevent the access of the male gamete further to ascend above into the female internal genitalia. Is that clear? Yes, fine. So now we are starting with today's sponge. So basically, as you can see in this image, this is the shape of the today's sponge. So it is similar to the shape of a mushroom, right? So it is called as a mushroom shaped device which is having a concave surface. As you can see here, it is having a concave surface here, and this device comes with a loop in itself, right? So the major function of what this loop is actually being provided with this today's sponge will be dealt later on, right? But as of now, you can see that it is circular in shape, similar to the mushroom. So it is a mushroom shaped device which has a concave surface, and it comes with a loop in itself, right? As you can see here, it is manufactured as today's sponge. As you can see here, 3 vaginal contraceptive sponges are present here, right? Okay, so now this today's sponge is made up of polyurethane. It is made up of polyurethane, and the most important point to remember with respect to today's sponge is that it is a disposable, right? So today's sponge is actually a disposable barrier contraceptive, and at the same time it is also expensive in itself. So it is a disposable contraceptive made up of polyurethane, and it is expensive. And today's sponge differs from diaphragm in one such important feature, that is that in order to increase the efficacy of the diaphragm, you need to use diaphragm in conjunction with a spermicidal agent. Only then the effectiveness of the diaphragm will be met. Why? Because is that the diaphragm is not sperm proof. So for that reason, you're going to use a spermicidal agent which is going to decrease the motility and the vitality of the sperm. But the difference between the diaphragm and today's sponge in itself comes with the spermicidal agent. As you can see here, it has been mentioned here that the today's sponge is containing nonoxynol 9, and we all know that nonoxynol 9 is the spermicidal agent. So there is no need that you need to use spermicidal agent separately in conjunction with this today's sponge, because the today's sponge in itself is containing a spermicidal agent which is nonoxynol 9. And how much of nonoxynol 9 is contained in today's sponge? It is about 1 gram of nonoxynol is contained with each today's sponge. Clear? So it is made up of polyurethane, it has a concave surface, and it comes with a loop in itself, and it is disposable, and it is expensive as well, and it has a spermicidal agent in itself which is nonoxynol 9, which is most commonly used spermicidal agent. And how much nonoxynol 9 is present in today's sponge? It is 1 gram. Right? Fine. Now coming to the insertion part. How are you going to insert this today's sponge? So today's sponge should be inserted high up in the vagina. So in the vagina, high up in the vagina, you have to insert this today's sponge. So if you are going to insert the today's sponge high up in the vagina, which is the part which is immediately near to the highest part of the vagina, that is the cervix, right? So therefore this today's sponge is going to cover the cervix as well. So as you can see here, this is the today's sponge, right? And this is the today's sponge which is fitting high up in the vaginal canal, right? So it is therefore covering the cervix. So the cervical portion is actually covered by this today's sponge. So therefore, when the intending couple is going to have the act of coitus, the sperm cannot access its further ascent or further entry beyond this barrier contraceptive. So that is the use of this barrier contraceptive. Now you may have a doubt that why this today's sponge comes with a loop. Today's sponge is coming with a loop because when you are going to remove this today's sponge later on, when the couple is going to, when the female is going to remove the today's sponge, the loop of the today's sponge can help in its removal in itself. So if she's going to grasp the loop, then she can eventually just remove the today's sponge out of a vaginal canal. So for the main reason it is being provided with a loop is for its ease of removal. And you may have a doubt that why a concave surface is present in this today's sponge. It is because the cervix will fit inside this concave portion of the today's sponge. So the concave portion of the today's sponge will be fitted against the cervical portion. Clear? So it is going to cover the cervix and it is inserted high up in the vagina, right? And the loop is for removal. Excellent. Now coming back to its mechanism of action. So as we all know, today's sponge is going to act as a physical barrier contraceptive. And the major function is that it is going to prevent the entry of the sperm into the cervical canal, and it has spermicidal action towards the sperm because this non-oxynol 9 in itself is containing the spermicidal agent, that is non-oxynol 9, right? That is 1 gram of non-oxynol 9 is present in this today's sponge. So it is going to prevent the entry of the sperm into the cervical canal, and at the same time it is going to have a cidal action against the sperm since the today's sponge is containing a spermicidal agent in itself, right? So dual action is being present with this barrier contraceptive. Now coming to the time of usage. So maximum number of time of usage is also very important. So let's have a quick rapid revision now, right? So the male condom can be used only one time. The female condom can be used 2 times, that is 1 time she can use it actually, and she can just use it, reuse it again for 1 time. So totally 2 times the female condom can be used. And when coming to diaphragm can be used for a period of about 1 year, and the maximum time a female can wear this diaphragm is about 24 hours. Clear? Yes. Now coming to the today's sponge. What is the maximum number of time of usage? The most important disadvantage with respect to today's sponge is that it is only single time usage. So today's sponge is fit for only single time usage. Only for one act of coitus you can use this. Is that mean? No, it is not like that. It means that once you are going to insert the today's sponge inside the vaginal canal, it can be used only for once. So once you have inserted it, you can just remove it after the set hours, which means, let me show you here. The maximum time it can be used once inserted is about 24 to 30 hours. So what I mean here is that once you are going to open the bag and introduce this today's sponge inside the vaginal canal, 24 to 30 hours after the insertion of the today's sponge, you can use during this 24 to 30 hours. That is, irrespective of number of coitus being had in the 24 to 30 hours, she can use the same today's sponge. But after 30 hours after insertion of this today's sponge, she has to remove it and throw it off. So it is actually disposable in nature and it is expensive. So it is only meant for single time usage, which means that once it is inserted inside the vaginal canal, it can be used for around 24 to 30 hours, which means multiple number of act of coitus can be had by the patient within this 24 to 30 hours. It doesn't mean that after 30 hours she can have. No, it is not like that. Once it is inserted, for the next 24 to 30 hours after the insertion, she can have how many number of coitus she can have. But after 30 hours after insertion, she has to remove it and throw it off because it is disposable in nature. Clear? Yes. So this type of contraception is particularly suitable for females who are going to have multiple act of coitus in one single day. So 24 hours is one single day, right? So in one single day, if a female is going to have multiple act of coitus, she can very well use this today's sponge because this today's sponge is effective for 24 to 30 hours. After 24 to 30 hours, you have to remove this today's sponge and dispose it off. Clear? So the maximum number of time of usage is single time usage. The maximum time it can be used once inserted is about 24 to 30 hours, right? And what about the time of insertion? how much time before the act of coitus she can actually insert this, and how much time after the act of coitus she can remove it. So before having the act of coitus, she can insert this today's sponge about 24 hours initial also. So before 24 hours of act of coitus also she can insert this. But this today's sponge is actually effective for 24 to 30 hours. So after 24 to 30 hours, once inserted, she has to remove it, right? So from the time of insertion, the effectiveness of this today's sponge will be calculated. So 24 hours before the act of coitus, she can actually wear this today's sponge. And after having the act of coitus, what is the maximum time it should be left inside the vaginal canal after having the coitus? It is 6 hours after the act of coitus. She has to leave the today's sponge as it is in the vaginal canal. Only after 6 hours have passed after the act of coitus, she can remove it and dispose it off. It is clear for you? See, let me just repeat it again once for you. See, today's sponge is basically a disposable barrier contraceptive. That is, it is only fit for single time usage, which means that once you have inserted this today's sponge inside the vaginal canal, it can be inserted maximum for a period of about 24 to 30 hours. After 30 hours, you cannot just keep it inside because the effectiveness of this today's sponge will also decrease. So once inserted after 24 to 30 hours after insertion, you have to remove this today's sponge and dispose it off, which means that this today's sponge after insertion for a period of about 24 to 30 hours, it is effective. So for this set period, that is for 24 to 30 hours, she can have n number of act of coitus if she wants. But after 30 hours, she has to dispose it off. Right? This is clear? Yes. Now the second important fact you have to remember is that what is the maximum time before having act of coitus she can insert this. That is 24 hours before the act of coitus she can insert this. And what is the maximum time it should be left after the act of coitus? After having the act of coitus, it should be left inside the vaginal canal for a period of about 6 hours. So only after 6 hours after the act of coitus, she has to remove this and dispose it off. Why? Because is that, see, the intending couple had the act of coitus. So the male gamete will be present inside the vaginal canal. So immediately after having the act of coitus, if she is going to remove this today's sponge barrier contraceptive and throw it off, there might be chances of failure of this contraception because this male gamete might ascend further up inside the cervical canal and gain its entry inside the uterine cavity as well, right? So fertilization as well as implantation might happen as well. So in order to decrease the failure rate of this contraception, it is well that it has to be left for a period of about 6 hours after the act of coitus in order to prevent the failure of this contraception. The one similarity point between this diaphragm and today's sponge is that it is similar for both the diaphragm and today's sponge that after 6 hours have passed from the act of coitus, it has to be removed. So how much maximum time after the act of coitus it can be removed? 6 hours after the act of coitus, the device can be removed. Which device? Both the diaphragm as well as the today's sponge can be removed 6 hours after the act of coitus in order to prevent the failure rate of this contraceptive. Right? Okay. Now what is the failure rate of this today's sponge? The failure rate is that among 100 women who have used this particular contraceptive, about 9 to 30 women ended up in pregnancy. So 9 to 30 per 100 women years is the failure rate of today's sponge as a physical barrier contraceptive. Clear? Yes. So now similar to the diaphragm, even today's sponge does not protect against the transmission of sexually transmitted diseases. Why? Because it's that the male is going to have coitus with her partner, right? So this male gamete, that is the sperm, can enter inside the vaginal canal. The only point is that high up in the vaginal canal, this barrier contraceptive is inserted. But then the lower portion of the vaginal canal, there are certain vaginal secretions being present. So therefore, the male gamete is exposed to the vaginal secretions as well. In other words, any sort of infections from the male partner, that is sexually transmitted infections, can be transmitted to the female via the vaginal secretions which are present in the lower part of the vagina. So since the vaginal secretions are mixed with the infectious which are transmitted from the male partner, so therefore these contraceptives cannot protect against the transmission of sexually transmitted infections. Clear? Yes. And the second point is that certain people might have allergy or irritation to these polyurethane made barrier contraceptives, right? And the most important differentiating feature between diaphragm and today's sponge is that there are no risk of toxic shock syndrome in patients who are using today's sponge. You may have a doubt now that you told me that diaphragm in patients who are using diaphragm, there is risk of toxic shock syndrome. But in patients who are using today's sponge, there is no risk of toxic shock syndrome. Why is that? It is because diaphragm can be used and it can be dried, it can be washed and dried, and it can be maximally used for a period of about 1 year. Whereas this today's sponge is actually a disposable barrier contraceptive that it can be used only for a period of about 24 hours or let's say maximally 30 hours. After that you are going to just dispose it off. Even though it contains this spermicidal agent, but then the most important feature is that today's sponge is a disposable contraceptive, that it is not inserted for a longer period of time unlike the diaphragm. But diaphragm can be inserted for a longer period of time. So 24 hours the diaphragm can be inserted. After that you can just take it off, you can wash it and dry it and you can reuse again. But today's sponge is not reusable, right? So therefore, once it is not used for a longer period of time, once it is not reused for a longer period of time, then therefore there are decreased chances of infection. When there are decreased chances of streptococcal infections, then therefore streptococcal pyogenic toxins are not being exposed, and therefore there is no cytokine storm and there is no risk of toxic shock syndrome in patients who are using today's sponge. It is because of the fact that it is not used for a longer period of time unlike the diaphragm. Therefore, the chances of toxic shock syndrome is less, or it is no chance of toxic shock syndrome with respect to today's sponge. But with respect to diaphragm, there are chances of toxic shock syndrome due to streptococcal pyogenic toxin. Whereas in today's sponge, there is no risk of toxic shock syndrome. Clear? So, all we have discussed until now is everything about today's sponge you need to learn. Now, just winding up with the barrier contraceptive in this module, the most important features, we have discussed everything in subsequent modules, right? But now we are just going to deal with the failure rates of the barrier contraceptive which we have discussed until now. So the failure rate of male condom is 2 to 12 per 100 women years. The failure rate of female condom is 5 to 15 per 100 women years, which is comparatively greater than the male condom. And the failure rate of diaphragm is 4 to 6 per 100 women years, right? And the spermicidal agent, if used without conjunction with any sort of barrier contraceptive, spermicidal agents can lead to failure rate of about 30 per 100 women years, and today's sponge can lead to a failure rate of 9 to 30 per 100 women years. So spermicidal agent has the highest failure rate among the barrier contraceptive. Second, the today's sponge is having, because anywhere between 9 to 30 per 100 women years the failure rate which has been reported for today's sponge, right? Female condom has a higher failure rate when compared to the male condom, and the least failure rate among this barrier contraceptive is with the diaphragm, which is 4 to 6 per 100 women years. But then it also has the disadvantages of toxic shock syndrome as well, right? So whatever we have discussed until now is all about the barrier contraception. So if you have any doubt with regard to barrier contraceptive, you can write to me in the Gmail Mackler handle, and please do attempt the Mackler solve questions which are posted in both the YouTube as well as in the Instagram handle.